Let me talk a minute about detoxing. Detoxing is one of the most important things that I do with my patients, and it's not necessarily heavy metal detoxing, it's just getting detox pathways rolling. So the first thing I do with almost all of my patients is I look at their blood and we see if there's some congestion in that liver. And if there is, then we've got to attack that first and get them rolling. So we got to clean your body out, support the liver pathways, support the lymphatic detoxing, and then we can get started in treatment. So you got to start somewhere, right? So that's where I like to start. Get the digestive tract moving, make sure you're not constipated, because we start from the bottom up. If your bowels aren't working, we can't start with antimicrobials. If your liver is backed up, we can't start. So we go from the bowels to the liver. We move from the liver up into the body, we start detoxing it, and then last we get into the brain. Now the brain can be a tricky little deal there. So what happens for me is a lot of times I don't go straight after detoxing out of the brain. I know a lot of guys do. I know there's a lot of protocols to go after detoxing heavy metals, but sometimes once I get the bowel and the liver going, we dive right in. Some processes that I use for that is we always support making sure that methylation is working properly. We use a lot of herbs like slippery elm and Spanish moss. We use things like we use some things like charcoals and activated carbons. We use chlorella. We use a multitude of binders to get the body cleaned up. And then once we get the body cleaned up and we start into the antimicrobials, then we have to step our game up even another notch. We've got to add in things like ionic foot baths. They're easy. They're not all equal, by the way. I have patients that buy some and they see that theirs versus the ones that I have in my clinic are not the same at all. So make sure you get quality when you're buying. The next thing is you've got to go and check into castor oil packs. It's so much easier than some of the other detox therapies out there, and it's very, very, very low cost. So ionic foot baths, castor oil packs, infrared saunas are great. That's going to get it out of your entire body. And then the last thing I get patients on, coffee enemas. They're a little harder, a little more time consuming, and they feel a lot more invasive, but they are amazing and they help so much. So once you start adding all these detox systems into your treatment and you keep your body clean, you can move along so much faster, feel so much better, and then it's mission health. It's mission to be able to adapt. My mission is to get patients to where they can live their life, they can adapt to what they want to do, and they can have fun and enjoy life, getting back to all the activities that they've lost, that they can't do, just like everyone else, without paying all the consequences. That's the goal. Learn to detox.